Here we go. Good morning, ladies and gentlemen. Welcome to the last Muscatine County Board of Supervisors meeting for 2019 on Monday, December 30th. I will call the meeting to order. First item of business is to review the agenda.
Move to approve as presented.
Second.
Jeff has moved. DeSantos has seconded to approve. All those in favor?
Aye.
Item number 3, receive comments from the public. Anyone from the public wishing to address the board on a subject not already on our agenda, please step forward. Going once, going twice, no sale. Item 4, discussion and possible action to approve the claims dated December 30th, 2019 in the amount of $419,073.93.
Second.
Scott has moved to approve. Jeff is seconded. Is there any discussion? All those in favor?
Aye.
Motion passes. Item 5, discussion and possible decision regarding authorization for emergency communications radios for the medical examiner's office staff. Good morning, sir.
Good morning.
We got all kinds of extras.
All right.
So I guess my first question for you folks is where would you like me to begin? Are you familiar with anything with the radio situation within the office?
Pretend we aren't.
Pretend we are. All right. We were given radios approximately, I think, a year and a half ago, maybe 2 years ago, from Matt Schuff with Muscatine. And when Beverly maybe came in to take over for Mr. Schuff, she retrieved all but one of our radios, stating that they were to be given to other fire departments and other emergency responders and not us. So right now, we just have one radio. There are several reasons, and I passed the papers out to you. I gave you a quote for one radio. We are requesting 5, which would be the amount of $11,270. We are an end user with Muscatine. They receive and dispatch us to all of our calls. So if there is a death in the county, the death of a nursing home, wherever there's a death, they call 911, we are dispatched. Several reasons why we'd like to have the radios back or get radios is, I guess our number one is safety for us. Many times we're left alone after law enforcement leaves. The reason they leave, probably volume of calls, so they can't stay. They're short-staffed, as everybody is. We have found in the past that a death can rapidly change emotions with family members, and we've seen that quite often. I had 2 deaths 2 days ago, and at both of the scenes, the officers left after I got there, just to give you an idea. One of the other reasons we are requesting the radios is when we're dispatched, right now, we're keeping track of our own time, so it's my watch, his watch, your watch, whatever. We like to have accurate time documentation of arrival, specific requests when we get them. We have if we did get the radios, we'd have direct and immediate communication with Muscatine Direct, law enforcement agencies, first responders, and ambulance personnel. And that doesn't sound like a lot, but it is, because sometimes when we do go to a scene, if there is a problem, they would alert us up front, like, don't approach the scene yet if there is a problem, situations like that, which we have had in the past. We do have cell phones, obviously, we do get a cell phone allowance, but we can't always rely upon those for quick communication or quick connection to Muscom. We do use them to contact pathologists, everything else that we do need to do on the scene. I guess if you have any questions for me, I'm just trying to highlight here is why we would like to get them back. Again, it's a good direct communication with us and dispatch, and if we do need the officers to come back, we can do it quickly as opposed to picking up the cell phones.
Give me a little history, Tom. So in the original project, when we did the P25 communications, the medical examiner's office was issued one radio, that's correct? And you currently have that?
We were issued 6. And then
But the original project, when we went, cause that was one of the things I think that we found has happened was radios were not given to certain groups that were part of the original project, committed to those groups. And so we've had lots of issues, and so they pulled radios back to try to get them out to where the original funding was and said, okay, this group was supposed to have these, they need to have them. Cause it's been a bit of a mess, to say.
It has been. And I
So
was
do you
on-
know what the original allocation to the medical examiner
No, I
was?
do not.
I don't believe that the medical examiner's office was included in the original allocation.
There was no allocation in the original, okay. And then,
I do know that Trinity Muscatine, they do have radios, and they are in the process of purchasing theirs, and then they are to return theirs to Muscatine once theirs is purchased. And, so we thought maybe we might be able to obtain those, but
Well, and I think some of the complication here is, that the 28E agreement that Muscom operates under specifically states that all communication equipment will be issued from Muscom to the approved end user. So I think it's the MCJCC commission that actually needs to make the decision to purchase the radios. This step is because the medical examiner's office is a county department.
we need funding. Right.
Well, no, potentially funding, I mean, that's a deal that we'd have to work out with MCJCC, but the bigger issue is, even if MCJCC will purchase it like they did for the others, you guys, if you allow them to have radios, are making a commitment to, if they're lost or stolen, to cover the deductible for the insurance, and those sorts of things. So once we talk through this, I think there's 2 steps to this. The first step is for you guys to authorize that you agree that yes, they should have radios. And then it needs to go to the Muscom Commission, to say, yes, we're willing to allow these additional radios on our system, and then determine whether Muscom's gonna pay for it or if the county's gonna
Right.
pay for it.
And there's more complicating factors in here because we have port and user fees that are assigned to every radio, and we have a certain number of ports available. And I'm not sure, I haven't spoken with Chris Jasper recently, because that's one of the questions I have is, you know, the radio becomes probably a trivial expense in the scheme of things, because we're charged so much per radio user that we have. And then, the other thing is we buy the bandwidth or ports in blocks. And I don't know that I have a good handle on today, how many. Tom, do you have a kind of a thought? Because we have more than 5 medical examiners, I
yes,
believe.
there's 6 of us.
And there's 6 of you total.
And they already have 1 radio.
And we have 1 radio and I think that came out of the spares
Actually, yes, it did.
inventory.
Cash, yeah.
Right now, as of this morning, our call volume has increased quite significantly this year. We're at 277 death investigations as of this morning. As of compared to 59 last year.
So I don't really understand, how you dispatch medical examiners. Do we share radios? Do we, cause this has been an issue that we've had when we went to the P25 system, and now you're gonna test my memory of history, and it's not that great always, but I think when we originally looked at radios in the county and we went to a P25, we had some 650 odd radios in the county, throughout the county. And that's what we budgeted and replaced, and that was about 1.9 million, if I recall right, to acquire those radios and programming. And so, that's kind of where we've been, but I don't know that we ever really thought about the process that we would go through. I think the users group, the MCJCC users group is kind of, has that recommendation, I think, to the commission now.
That's typically how it happens, yeah.
And then funding, we have to figure out how do we fund it and where's the funding come from? Okay,
The cost that we have in front of us is for 1 unit,
Yes, sir.
and what was the total for all?
11,270.
well, this is the time to consider these requests because we're just getting ready for our budget process. But that's just the base radio and radio equipment cost,
That's not linking into our network.
right, that's. Yeah, we have the user fee, port fees, but I don't know what, I would have to look at that, and then the other thing that we would take as a commitment here to ongoing maintenance, because what we're finding is radios, and I don't know what the recommend, 2-year life on batteries, they're saying, something like that?
I'm not sure.
Ours have lasted longer than the fire department.
Okay, yes, and then that's our next big budget expenditure is batteries,
And
cause I think we're starting to
those are
see
being funded through Muscom or E911.
E911 or Muscatine.
Yeah. And the other question, I'm just gonna throw it out there because it's come up, is, whether any medical examiner, investigator who has a radio because of another job should get to have a second radio. I know that question has come up, and I think you're is it you and Darren? So we have 2 of the medical examiner investigators who
Currently.
right
That
now.
would be changing, yeah.
Yeah, who right now have a radio because of their jobs
At the fire department.
at the fire department, yeah.
But those radios are a little different than what we're asking.
And
for.
programmed differently probably as well, aren't they,
Not
Tom?
necessarily programmed different, but they're more safe for us to take into the
Right,
fire.
right, they
So
have
they're
different.
about 5,000 piece.
Yeah, they're
Uh,
certainly more
I
expensive.
think
right
a
now.
little more.
Right, and we had made the idea not to take those out of the station for several reasons. Number one, the other gentleman does live out of town. If he forgets it, he has to go back and get it without paying, et cetera, et cetera. So there's other matters and complications with that. So we just decided that not to do that.
And so that these radios would be issued to, medical examiner, staff, and they would be domiciled at their homes?
Correct.
And I don't know on our insurance, does that,
Because simply, the reason is because you need to understand, most of ours people live out of town. So for them to, that was the idea with one radio, but it didn't work well. Because if we get off at 6, sometimes we'll split a day, where we work 12 hours versus 24 hours. So if our investigator lives in Columbus Junction, we'd split a day, then they'd have to drive all the way back to Muscatine, bring the radio back and get it. And the idea is to have it with them when they are dispatched, and then they would have direct communication with whoever's at the scene. Whether it be,
Okay.
ambulance, sheriff.
And from the insurance standpoint, we've not encountered there being any concerns about these being domiciled.
I can guarantee you,
At home.
volunteer firefighters keep theirs at home.
Yeah.
right?
Guarantee you that.
Yeah. So really, it's 5 plus 1, or it's,
I'm just asking.
5
we
total.
Because they have
It-
one
it
already.
would be-
have one already that I use, and then so the 5 would be. for the-
but I wanna be clear, so for the medical examiner's office, it would be 6 radios.
Yeah.
6 total, yes, sir.
Okay.
Is that one radio already linked into our
It
P25?
has been,
Yes.
sir.
Okay, so who could get us an idea of the cost? Because we, as has been pointed out, we just have the equipment cost here. Who could get us an idea of the
I
total?
would say Chris Jasper would be
Yeah.
the one.
Chris,
to-
okay.
I'll
Reach out
talk
to
to
Chris,
Chris about
okay.
this, cause I think he and I have spoken a little bit about it, okay.
Yeah, I
And
think,
then again, and Chris would be the one to ask about this, but there are radios, there are access radios that we do have, and I know some of them are committed in case of a, natural disaster, things like that, but there are radios there, and like I said, the hospital is purchasing 5, and so their 5 that they currently have for the security will go back to Muscatine also.
Yeah, I know this came up at MCJCC a number of months ago, and, we have a number of groups that, quite frankly, don't have the radios that they were originally slated to get, and would find, that's what they found is they're elsewhere, because they were loaned out of however it happened. And so you really can't go to somebody saying, we're looking for more radios, when they never really got what they were supposed to have in the first place. And I know Chris is working really hard on getting that all squared away, and we've had some issues with all
And I
that, and I think we're getting closer.
I believe we're down to one radio that just simply cannot be found. They believe it was issued, I think, to West Liberty, and it just cannot be found, so we're gonna file an insurance claim on that one, and then I think all the radios have been accounted for.
Good. Okay, so, you know, I would speak to, I don't have a problem with the medical examiners and communication, and I know we did, so talk to me a little bit about the cell phone allowance. Is that something you would see going away? We added that a couple of years ago in the budget
We added
process.
this past year. No, I don't think so, because we do use the cell phones even at, you know, of course, at the scene if we can. We have had a lot of communication issues of late. I don't know whether it's the service that I have or not, but I mean, even in town, it doesn't have to be out in the county at all. I mean, we'll drop service. Matter of fact, I had a call the other day. I finally had to go out and go outside and go about a block away just to get a signal to use the phone in town. We use our phones to contact Dr. Weiss. We use our phones to contact the University of Iowa for autopsies. I mean, we use the cell phones a lot.
Okay.
It's just that at the scene, sometimes they work, sometimes they don't. I know I'm not the only one that have experienced that. I know a couple others have too, even officers at the scene have problems with. And again, it's, the number one priority for us is safety, because I've been involved in 3 where everything is fine, and then in 30 seconds, a distraught son or daughter comes in and things change. And that is our number one reason, and like I said, I think we lost one examiner about 1.5 years ago because of this, the radios. He said that, you know, if we didn't consider his safety first, then he wasn't going to work for us, and he did leave. But again, that's our priority, is safety. And I think anybody that works in the office will tell you that.
So Nancy, another question I have, so if the board were to allocate funds for this, this has to be accepted by the commission, or it actually Muscom would have to, we'd have to do some kind of a grant of the funds, they'd have to accept the funds and then,
That probably would be the cleanest way to do it, would be, yeah, for us to grant the funds to MCJCC, and then they would actually make the purchase. And that keeps us within the confines of our 2080.
okay. And do you know, I'm just asking questions off the top of my head, so watch it. Do you know that if medical, you know, some of the, a number of things out of the dispatch center are funded through E911 dollars, and I see Brian here this morning, but is medical examiner services, are they things that are eligible for E911
No,
funding?
no, I don't believe they would be in any way.
Okay,
The E911 funds are intended to fund the operations of an emergency communications center,
right,
so.
okay.
You know, I look at these things like this all the time, and I always weigh the needs and wants. And Tom, you and I have had
Yes, sir.
several conversations in this prior year about this exact situation at hand. And it also sounds like we not only need radios, but we gotta make sure we still have our cell phones, because I understand your plight with having to have cell phones to contact other personnel that wouldn't be able to be contacted by that particular radio. So I understand your situation, and I think we need to have a conversation with Chris and look how this could be approached.
Yeah, so I don't know what would be on for action today, but I would certainly think this is something we should bring up in the budget, talk in our budget hearings to see, I mean, we don't obviously have $12,000 laying around, just right now, but that's something we need to look at in the budget process.
If you guys, yeah, if the board is interested in providing the funding to MCJCC, we can do that as part of our budget process. I put it on today because I wasn't sure what direction you wanted to go, if you were just gonna ask MCJCC to purchase the radios for this group, or how you wanted to go there.
Well, then I would also like to know what the total spend would be on it,
Yep.
because obviously it's just beyond the equipment, so.
Yeah, and
What I
I
might see if Chris is available, and maybe come to, you guys, this particular week, you guys have to meet again on Thursday for your organizational meeting. It's a brief, but I might see if Chris is available Thursday or next Monday to maybe just kind of give you guys a quick update on, have we found all the radios, what's going on there, and then he should be able to answer the questions
All right.
that you've raised today, if that
I know
works for you.
JCC budget was not in terrific stead for some other things, so they probably don't have the funding at this point either, I would guess. Okay,
That'd be good if Chris could come and address us.
Okay,
okay.
Alrighty. Good to go. Thank you, Tom.
Thank you very
Appreciate
much.
it.
Thank
Yeah,
you.
thanks, Tom.
Alrighty. Excuse me. Moving right along to item 6, we have items with Community Services Director Felicia Toppert. Good morning, Felicia.
Good morning. I got a couple of things this morning. I wanted to let you know that we're not just totally focused on mental health. We also are working on other aspects of streamlining the Community Services Department. And one of those things is we'd like to change the trajectory of the food assistance process that we have. Back when the food pantry was in the back room, we had food sacks and non-food sacks, and we kind of passed those out in emergencies. Well, those food sacks originally were supposed to go with the food pantry, but for whatever reason, they didn't go. And so we are in the process of getting out of that emergency food sack business and non-food, and putting that back to MCSA. They have the food pantry, and they really are the emergency provider of food, as opposed to our department. Part of that trajectory change is also about making sure that the county is the payer of last resort. And we have a pretty significant role in that, and ensuring that. And part of that is being able to do a better needs assessment of individuals who come in month after month after month. It may be as simple as their housing is too expensive and we can refer them to low-income housing. It may be a situation by which they have fines and their budgeting is not as good as it could be. And we can make referrals to other agencies in the community to help with that budgeting process. So the needs assessment and then the service coordination for those folks that are repeating their contact with us. Because really our goal should be to help them become more able to sustain themselves. Even if it's a matter of going to other community agencies and taking advantage of programs that they haven't accessed yet, or they don't even know exist, for that matter. And that includes being able to find higher paying jobs and maybe training programs and some of those kinds of things that we can inform them about and help them get to. So that's the biggest part of that trajectory. But in getting rid of the food sacks, there's still a need for food assistance for folks. And what I mean by that is DHS and food assistance covers about 80% of people's needs. And then you have the food pantries who do what they do. And for the most part, they don't cover, I mean, some can, but it's not frequent. Meat, cheese, peanut butter, milk, bread, vegetables, fruit. Those kinds of things that can't be gotten anywhere else. And so I'm suggesting that the board approve an increase in those food vouchers by $4. And what I mean by that, and I'm gonna give you the number. So one person would be $18 in a month. 2 persons is 22, 3 is 26, 4 is 30, 5 is 34, 6 is 40, and 7 plus is 44. Okay? And those food vouchers go once a month. People aren't allowed to come every week and do that kind of thing. But at least it assists people in getting those food items that they can't get anywhere else, that are also important to being healthy and having a good diet. At least month to month, we can help them to try to get to the point where they don't need these vouchers anymore. We also do, non-food sacks, which is laundry soap, dish soap, bar soap, and toilet paper. All things that you can't use your food assistance through DHS, all things that are not necessarily sitting in a food pantry, but important to people's ability to be able to continue on day to day. And I'm suggesting that we do a $10 and a $15 once a month. We did some pricing of all those items, and you can purchase all 4 things for $15. And that would get somebody easily through a month. Okay? And the $10 would be for those folks that already have the bar soap and, say, the dish soap or the toilet paper. So we would just eliminate that out depending on what their need is. So that's kind of what we're looking at, and I wanted to have your approval to go ahead and make that change. The GA manual is in the process of being updated, because it hasn't been updated for a very, very long time, so we're working on that, and we'll bring that to you later.
So I wanna be clear on what the proposal is, so, pardon me, so we have these sacks we're giving out in the back, which have been a source of pain for us for some time. And so we would eliminate that, we're gonna stop doing that. But the service that provided, which is, money, funding to do that, we're gonna do that, but there's strings attached. They have to meet with a case manager or someone who's gonna verify the need and also make sure that we're working towards a self-sufficiency or help them, become more self-sufficient. And then you've also are saying that maybe you're gonna allocate just a bit more money towards those. Probably a little tougher to get, cause I can't just show up and get one.
That's right.
But those that truly need it are gonna be able to get maybe even a little more help.
Yes.
Okay. Perfect.
And I have to tell you, the stores that actually take our vouchers have been wonderful, and I contacted them to see how they felt about some of this kind of stuff, and I'm still waiting for feedback. So we gave them what the voucher looks like, because what happens is the person takes the voucher to the grocery store, purchases their items, and in our previous voucher, it says no snacks, no alcohol, blah, blah, blah. The new voucher will say items only, meat, peanut butter, bread, and so forth. It's very specific, so that there isn't a situation by which we have folks buying things that aren't nutritious and don't follow the goal that we want, which is to supplement those food pantries with the things that they don't do.
Right.
So the stores have been wonderful, so.
A couple questions, Felicia.
Uh-huh,
Number one, I've got a nephew with peanut allergies,
okay,
and I see this more and more. Can we do some kind of like peanut butter or substitute? I know some people use like sun butter or whatever that, just for people who have those allergies. I wouldn't imagine that's a big deal, but the other thing is, do you know what the projected net effect on the budget would be? Is this neutral? Is this up, down?
it should be at the worst budget neutral, it should lower.
Great. Okay, thank you.
So Felicia, how many people do you think that we're touching, if you wanna say, with the SAC program right now?
Oh my goodness. The SAC program, we have very little, I mean, other than to give them a SAC, we have very little contact with them otherwise. I would say we probably go through 20 to 30 SACs in a month. And those SACs do not have the items that I'm talking about. They still have dry items. I mean, it's cereal and Hamburger Helper and those kinds of things, and Hamburger Helper isn't very good without any meat.
It's just helper.
Yeah, I'm just trying to come up with how many people would we be affecting with this new change, and would we still potentially be seeing numbers increase or decrease? Obviously, there might be some sort of decrease with the challenges of more steps they need to go through, but I think it would be more of a step of self-sufficiency, obviously, what you're trying to do.
Well, and I think the goal that she outlined earlier is ultimately one of the goals of food assistance needs to be to get people off food assistance, and this allows us to track that a lot more easily. And
But I would like to know, I was wondering
Yeah.
what kind of metric, are we touching 100 people?
I
And
don't-
then 6 months from now, we can come back and say, yeah, we're touching 50 now, because now they've there's just.
Well, I think that's the
I don't know
advantage.
what to
Because
start
we
with.
just hand out a bag of food, we don't know where it goes.
And that's what I'm getting at, so
Yeah, I
don't
think
know.
that's the advantage of getting a case manager involved, because now we will know what our impact is and our issues are.
Well, and MCSA is right across the street, and they have the food pantry. And Scott and I are working together to try to figure out what's the best sort of scheduled process around the food pantry hours and some of those kinds of things. I mean, it's inevitably his program, but I also think that the emergency food assistance part is also a piece of the food pantry and not part of our department. It really isn't. Because the food assistance that we're providing is not emergency food assistance. So we're giving all the emergency food assistance over to MCSA and the food pantry that's over there.
So those sacks are still available, they just have to go across the street to get them as opposed to getting them from their office.
Oh, I see what you're saying. Okay,
We're consolidating the service.
okay.
Which I think was the board's intent when you moved the food pantry to begin with.
Right.
Okay.
So I'd make a motion to accept the proposed changes.
I'll second it.
Jeff has moved, Santos has seconded. Is there any further discussion? All those in favor, please signify by saying aye.
Alright,
Opposed, same sign. Motion passes. Thank you, Felicia.
The second item I'd like to talk about is the reapplication to the seal region. I'd like to suggest to the board that you reapply at their January meeting. And the reason that I say that is because we're coming up against our budget certifications. And if the seal region accepts our reapplication, then that recommendation goes to each of the 8 boards of supervisors for their approval as well, because it's actually a change in the 2080 agreement. And they just went through that process for children's mental health. So it's gonna take some time for that to travel around the way it needs to. And I think it would also be helpful if you're of a mind to reapply in January, that we attend some of those other boards of supervisors meetings, just to be present to answer any questions that they might have in that process.
Yeah, I actually think that's a great idea, because we know the wheels turn slowly, and we will have to certify by March 15th our budget. And we would wanna make sure we know what our per capita cap on our mental health levy is, so that we can, most important thing to me is we are able to budget at a level to continue to provide the services for our residents. So I would make the motion to, we're looking for I'd make a motion that we authorize for a reapplication. Now, have we made I would assume we've made some progress on aligning with some of the questions and concerns that the seal region had, and aligning contracts and doing some of that work. We've got a plan, so to speak.
Yes, we do, and basically, I'm gonna be submitting 2 separate budgets. One is if we're accepted, and one if we're not accepted to the region, and they are going to look drastically different. Because the seal region is levying 36 point, and I don't remember what the last 2 digits were, $36 and change, just for mental health. So that would be our mental health levy, and then on top of that would be our administration. So whatever our administrative costs are would increase the levy to that point. And the 36 and change would automatically go straight to the seal region. And all of bill paying and all of the contract monitoring and that sort of thing will be done out of the seal region. It will not be done by our auditor and having to do all that bill paying that they're doing now. We would be responsible for assuring the utilization and quality assurance for the services that are being provided. So an example is we're billed by Chatham Oaks for 2 people in an RCF, then we need to make sure that, one, they're getting RCF services and we have a plan for them, and they're not there on a permanent basis. So, that would be in our wheelhouse, and then the billing would go to Seal to be paid.
Okay.
So it's a much simpler process. When I met with them, they said, we have to decide what services we need. And then, their, rules state that if a provider serves more than 6 individuals, then there has to be a contract in place. And those contracts get reviewed, stem to stern, every 6 months. And they get, evaluated against actuals, so that we know that that money's going where it's going.
So if we were,
So, hang on, I'm sorry to interrupt, but we've got a motion, we need a second. Anybody wanna second it?
I would have questions still, but I can,
Well, no, I mean,
Seconded, continue
yeah,
discussion.
exactly.
okay, I'll second it.
Just so I don't forget, that'd be great. So Jeff has moved, Santos seconded. Please continue.
So, the resubmittal that we would provide here starting in January would make us an effective December 31st of 2020 for us to, or January 1st of 2020. What would the resubmittal, if they approve it, when would we go into?
July 1,
So it'd be for July 1,
yes.
okay.
Those are the dates that are of vast importance, because we will end on the last day of June, and we will start on the first day of July. And, am I correct?
Yes.
If that's all approved?
Yes.
Assuming we
Which-
stay in the
which-
region
if-
that, the
If the
Eastern Iowa
stars, if
region.
the stars are
Status
all to
quo,
align.
Yeah.
And that would be the most streamlined way, to have, service that is not hindered.
Felicia, I think one question that is being begged is, we submitted our request in November to Seal. They said no. What's different now? Why do we think that this one will be different?
We've submitted a tremendous amount of financial information for them to take a look at, so they can see how we are spending our money. The difficulty lies in the fact that how the eastern region is set up is so drastically different from how the Seal region is set up. The county pays for individualized services and those kinds of things out of our budget. The fiscal agent budget in eastern Iowa region pays for those crisis services only, okay? And in the Seal region, we're gonna take that $36 and change in levy and just give it to the Seal region. And we're gonna be paying for our services through them, individual and crisis. So it's gonna look very different, and it's kind of a hard concept for them to really, get their hands around. It's even harder to say that, because they do all the quality assurance and utilization review on the contracts that they have, and they know month to month how much is being spent in those budgets. They have a hard time with our system because we don't. And so that's a difficult transition for them. So we've given them all kinds of financial information for them to look over so that they can see what it is we've been doing and how much money has been put in to the region.
Earlier, Felicia, if I'm right, the administrative costs are gonna be a lot less. In the
Yes,
Seal region as well.
yes. And in both budgets, the recommendation is going to be moving some of my folks, all but me and one other person, over into Fund 1. And that's probably where they should have been all along, but nevertheless.
Can you explain what that means effectively for Fund 1?
Fund 1 is general assistance. And when we entered the Eastern Iowa region, those trust folks and virtually every person in the office was somehow placed in Fund 10. And Fund 10 is mental health. And so every aspect, some of their job was paid by Fund 1, some of their job was paid by Fund 10. And so all the trust folks, in particular, those three, were shoved over into Fund 10. 2 of them, almost 100% Fund 10, and they didn't belong there. But because they were dealing with folks with mental illness, the way the Eastern Iowa region is set up, it made sense that all of their salaries came out of the mental health levy. And that is not how it works in the Seal region. Fund 1 is general assistance, and that includes the VA, that includes their trust if they have it, that includes their general assistance folks, all in Fund 1. Even if they touch somebody that has a mental health issue, the work they're doing is not necessarily mental health related. So that's how it would be different. So our administrative cost is gonna go way down in Fund 10, and our costs are gonna go up in Fund 1.
But to help offset the cost increase to move to Fund 1, she's taken a look at staff and has eliminated a position and a half that was primarily funded out of Fund 1. So she's doing what she can there to minimize the impact of Fund 1.
Well, I'm a big advocate of costs where the costs are. So it is what it is. If these are services we provide, we need to provide, and we need to identify the costs and work and deal with that. So I'm encouraged by that,
And
actually.
it removes some of the complication that we now have, because right now, the way it works, nearly everybody working at community services, their salary and benefits are split between sometimes as many as 5 different places. And so that becomes very cumbersome when you need to make any sort of change. This will really clean that up and make the whole payroll process much simpler and much less likely to have errors, because you're not trying to change things in as many places.
So Felicia, one of the comments that I wrote down when I went to that meeting was the feedback that we had we had heard, and I think Jeff had mentioned it too, in regards to contracts being similar to Seal region. And one of the feedbacks that I got from the supervisor down there was just, align yourself more to what we are, and we will openly bring you in, versus just, I think what you had just mentioned earlier, we're so vastly different that I think that probably sent a fear factor more through them than opening the door for us to go in. So what have we done now besides this fund changes of staffing that we have done? Have we done any other things, or do we have a plan that we can share with them, saying these are the next steps that we're doing that are gonna align us to Seal?
Yes. First of all, we have a list of all their providers. So that, an example is our mobile crisis. They're just getting ramped up to mobile crisis. We've had it since September. Their provider is Community. And so, if we're accepted the Seal region, then we'll immediately do a contract with Community. Where we get into a little bit of a stretch is that those contracts are with the Seal region. So we can't sign off on a Seal region contract before we're accepted into the Seal region. So I'm very cognizant of that timing piece. We also talked about how we do coordination and some of those kinds of things, and getting some of that lined up. Des Moines County has the employs the 2 folks that do jail diversion and that sort of thing. And the question is there a need for a 3rd one, or is there somebody that we have currently that does that work, then we can just contract for that specific unit. So an example is, there's a therapist that goes to the jail, and in which case, is that one of those folks that we can contract with and pay them to do assessments in the jail as they're done? So not paying for the body, but actually paying for the service, if that makes sense.
No, I just wanted to make sure that
Yes.
way, if one of us goes back and attends these meetings, I would
Yes.
like to be able to know kind of, hey, this is what we're doing, we're already in these steps. Obviously, we can't make contracts with certain groups if they're with the Seal already, but if we're ready to have those conversations, they know that we're ready. that would move them forward to wanting to approve us. Come to-
And next meeting, I have, a planning meeting with a small group of folks, to talk about, the seal management plan and being able to, mold our services into that management plan. Because that really is what they need us to do, is we need to be in line with their management plan. And, that planning group, we're gonna take a look at that management plan and see how we do form our services into that plan.
When would be the meeting for this approval if we were to submit this letter in January? Would it be their February meeting?
It'll be their January meeting. Their January meeting is the second Wednesday, right?
I believe that's right. So that would be the 8th.
Soon.
Now, much was made of the reason we applied in November was because the application deadline is November, and that's true. However, that their 28E contains a provision that allows the board, if it wants to consider applications submitted after November 15th. So, while that was the original deadline, they have discretion to waive that deadline. But yeah, I think Felicia's done a great job, both what she's shown to us and what she's been working on behind the scenes to really align ourselves with the SEAL model, which we think is a very effective one and more cost effective than what we may have now. But you know, everything she's been doing has been, you know, just fighting to provide and guarantee better services for the folks that we're trying to take care of going forward. So, we have a motion on the table. Is there any further discussion?
Could you email us the dates for that, the
Will do.
February meeting? January meeting, I'm sorry.
So, how would you see this playing? Go the application first and then potentially us going to supervisor meetings after?
Yes.
As they're kind of presenting this to their region members?
Because
Okay.
I think we need to present it at the region meeting because they're the ones that have to accept the application. And then after that is the process of updating the 2080 agreement, which requires each of the boards of supervisors to agree to that change.
Okay. Okay. Very good.
You said 8 of them?
Yes. All right. With no further discussion, all those who are in favor of authorizing a resubmission of our application to SEAL, please signify by saying aye.
Aye.
Those opposed, same sign. Motion passes. Thank you so much for all your work, Felicia.
Thank you.
All right. I suppose I should ask under item 6C, is there any other?
No.
All right, thank you. Number 7 is discussion and possible action to approve the minutes of the December 23rd, 2019 regular meeting.
Second.
Scott has moved, Jeff has seconded. All those in favor?
Aye.
Item number 8, correspondence. Santos, anything?
I went to the waste plant for the new Grandview Avenue proposal that they're doing with the city, on the 17th. And didn't have anything else besides that.
Okay, Jeff?
Nothing to note.
I did not. Scott?
I had nothing to know.
Doug?
Correspondence, I received a call from asked you with concerns about the mental health region. And I talked to Dave Watkins about the bridge at 132nd and North Isaac. He would like to know if we would consider that a 5-year plan. I know there's a lot of weight limits on it right now.
Something to tell Keith about, I imagine.
Yeah,
132nd, is that the one over, goes down to the old?
it's by the Kaufman place there on North Isaac.
We just have Bridge 132, I presume, or not.
Yeah, that could be Keith.
The south of the Steel Mill Road. That one.
It's,
130 to 132nd.
Trying to figure
I,
out which bridge it is.
I call it Kaufman Place. It's, before you get to, I thought that was 132nd Street on North Isaac, but maybe it's 130th.
Yeah, I'm trying to pin the bridge. to that.
Yeah, I think it's a little bitty one that he's talking about. I
Well,
think I know
everything
what
on that road has weight limits on it, except the new one we just built, and some are in the program and some not.
Yeah, 132nd just goes over to Moscow Road from North Isis. Well, we can figure it out.
Yeah.
Any committees, Doug?
Yes, December 18th was the annual Will Development at Sonic Temple. And December 19th was the Utility Board meeting at the River Center. And we're meeting with Ryan Schreck from Muscatine Power and Water tomorrow morning concerning the power line and some possibilities to get a route set. That's all I have.
Thank you, sir. Scott?
I had nothing.
I did not have anything either. Jeff?
Nothing to know?
And Thomas?
I just had the We Lead, meeting
Okay.
on Thursday.
Sounds good. My agenda back here. Item number 10, any information from county employees? Either of you gentlemen?
There will be another, one of the transmission line meetings with, invited property owners. It is an open meeting on January 16th at 5 p.m. Probably plan on attending, I'll go ahead and forward you that as well.
That was January 16th at 5 p.m.
Yes,
I thought it was the 9th.
Thursday, January 16th at 5 p.m.
Is that also the Riverview?
That's, I got just late last week
Where was that gonna be?
at MPW.
Oh, at MPW. Okay.
Usually they
I'll
do.
verify everything then.
Okay, thank you. Anyone else? Okay, item 11, items with the administration office. We have A, action to accept the December 2019 payroll claims.
Move to approve.
Second.
Jeff has moved, Santos has seconded. All those in favor?
Aye.
It's approved. 11B, Nancy, anything else?
I have nothing else.
All right, folks, we're about to finish up the year. Anybody have anything they need to get in, can't handle?
It's been a good year.
It has been. We are adjourned. See you next year.